Some Filipinos have confidence in accepting the vaccine, while others remain to have reservations upon consenting. Vaccine hesitancy in the country has been an issue since the onslaught of the Dengvaxia vaccine in Pinoy's presidency. Today's issue: health workers agree in taking the COVID-19 vaccine to set an example to trust science and trust whatever brand that has been ordered by the government. Infographics with regards to the effectiveness of the different vaccines are also on social media. It is still debatable whether the recipient of the vaccine has the liberty to choose whichever brand he or she prefers. In today's episode of Lifeline, we are going to know more about the process of the vaccination and the effectiveness of the different vaccines. Join me, your host, Hans, together with the experts as we equip ourselves with the right knowledge. This is Lifeline. We improve our lives by feeding our minds. Confusion, lack of clarity, and the low confidence rate to the vaccines are the contributing factors to the vaccine hesitancy here in our country. Together with us is a member of Philippine Society for Microbiology and Infectious Disease, Infection Prevention Control Committee, and a Thomasian doctor, Dr. Daisy Ilagan-Tagarda. Yes, good afternoon, Doctora. She will shed light to us upon this very important issue of today and why the citizens are highly encouraged to participate in mass immunization. Again, good afternoon, Doctora Daisy. We are delighted and very lucky to have you in our show. So
Good afternoon, Ness. Good afternoon to everybody watching your show, especially the Thomasian community.
Yes, okay. Before we start, Doctora Daisy, I'd like to know how's quarantine treating you so far? It's been, I don't know, it's going to be almost a year now. So how's your, how's the setup there in your place?
Well, we're so excited to go back to normal. It's almost a year that we are isolated and we want to socialize already, but of course we have to be cautious still. No, we still have ongoing online classes in UST and in different schools. So with this campaign regarding vaccination, I think it will help us to go back to normal that we used to have before.
Yes, that's true. Well, Doc, you mentioned about the vaccine, right? So people are hesitating to participate in the mass immunization. Doc, are there any reasons for us to be alarmed or, for us to not consent?
Okay. So number one is once the vaccine is available, it is granted that the FDA of the Philippines has given the EUA, which means emergency utilization approval, which means that the set of doctors and the set of scientists has reviewed already the data on the interim trials of these vaccines, which means that it is efficient enough to be given to the population, and at the same time it is safe also to be given. So as a point of view of an infectious disease specialist, there's nothing to be alarmed of regarding the vaccine. So we have to be educated right now that the principle in giving these vaccines is we usually consider weighing benefit over harm to to other people.
Right. I agree with you. But, Doctora, with an array of brands such as AstraZeneca, Novavax, Pfizer, Moderna, Sinovac, Gamaleya, Covax, and all that, how can we understand the efficacy of these vaccines? Are all the vaccines available in the market safe enough?
I think the government and the FDA has a certain standard to approve a particular vaccine regarding to its efficacy. The efficacy is actually related to its the ability of the vaccine to protect or to reduce the risk of this vaccine to the individuals who received the vaccine as compared to those who did not with regards to COVID-19 infection.
Mhm.
So there's a certain quality of the vaccine based on the initial result of the trial. No, I think what we
Mhm.
want is a higher efficacy and, of course, very safe vaccine for our people.
Right. Doc, let's talk about efficacy. As we all know, there are some vaccine that has a better efficacy compared to a different one, right? So, what are your thoughts on these efficacies? Earlier you told us that the higher the efficacy rate is much better. What about the lower ones? Should we be alarmed to it?
As long as it has a, I think the approved efficacy rate that we want to achieve is at least 70% and above. This is based on the computation that we want to meet this efficacy to end the pandemic, based on the epidemiology studies. No, so with regards to the efficacy, we also have to consider the ability of our LGUs to handle the vaccine. So if we have an efficient vaccine or effective vaccine to prevent the infection, however, we don't have the capability to handle the vaccine, then that will be in question as well. So if we don't have the capability to an efficient vaccine, so we can opt to another vaccine that is easier to handle. Like, for example, your AstraZeneca. AstraZeneca usually requires only 2 to 8 degrees Celsius
Right.
storage as compared to the mRNA vaccines.
Mhm. Okay. Thank you for sharing that, Doc. Now, I just like to ask, will the Filipinos be given the chance to choose which vaccine would they want to take?
As of the moment, we only have limited number of vaccines that has been given EUA. So we will
Mhm.
only have as of the moment, we only have Pfizer and Astra, and some other brands are still ongoing approval
Mhm.
for the FDA. As far as I know, no, I'm not part of the government implementing
Mhm.
the vaccination. The local government unit will be the one who's going to be in charge on the availability of the vaccine. So that's why we encourage whatever vaccine is available, as long as it has the FDA approval given
Mm.
EUA, then you have to receive it.
Oh, right, right. Okay. Thank you for clarifying that, Doc. So now I want to know, what are the procedures if we are going to get vaccinated? What are the preparations? Do we need to have our swab or rapid test? What are the things that we have to consider in terms of our health before getting vaccinated?
Okay, very important to note is the priority of the who we are going to give the vaccine.
Mhm.
So first, of course, those who are the highest risk or most prone to have to acquire the infection, which are the frontliners.
Right.
So the government actually decided to prioritize them receiving the vaccine. So
Mhm.
actually, I'm expecting to receive the vaccine in few weeks to come. So
Wow.
yeah, I will really receive the vaccine, and then the next population will be the one who are considered vulnerable. These are the elderly population. And then if we have the chance, no, if we have enough supply of the vaccine, I encourage everyone, adult patients, adult individuals, to receive the vaccine, because we need to achieve that 70% immunized patients in the people to end the pandemic.
Right, right. So does it mean, Doc, correct me if I'm wrong, but does it mean that basically 70% of the Filipino population should be vaccinated for us to kind of, stray away from this pandemic?
Yes, that's why I actually accepted this invitation to at least educate and encourage everyone. Please do not be afraid to receive the vaccine. This has been studied extensively, although
Mhm.
there are adverse reactions, but of course there are protocols that we have to follow to observe the adverse reactions, and most of them are actually mild adverse reactions.
Hmm, right. Speaking of reactions, Doc, what do we expect after getting the first dose of the vaccine? Are there
Well,
things that we need to avoid? Can you explain further?
okay, the preparation, you have asked about the preparation. There's no special preparation regarding the receiving the vaccine. We just will tell the patients and the individuals to rest properly. And then we do not give the vaccine for those who had COVID-19 within 3 months.
Oh,
So this is because there will be an interaction with regards to the immunogenicity, which means the ability of the vaccine to produce the protection that we want to achieve. No, there's no severe adverse reaction, but it has something to do with the ability of the vaccine to produce protection. Now, the usual adverse reaction that has been documented from the previous trials were just the usual soreness at the site of injection, fever, which is actually self-limiting, and then there are just few very severe adverse reactions that necessitated the patient to be admitted in the hospital. This is very very low, and the usual will be fever and site injection, and some of which developed allergic reactions. So these are just the usual adverse reactions that has been documented. But we cannot predict who among them can develop such adverse reactions.
Yes. It depends on the person, right?
Yes.
Okay. So now, Doc, what is your message to the Filipino people here in this live about those who are hesitant in trusting the vaccines?
Okay, my message to the people, especially to the Famasian community, please do not be afraid and be alarmed about the COVID-19 vaccine. Please do get your vaccine once you get the chance to receive it. This is our hope to end the pandemic.
Yes.
Thank you, everyone.
All right. Finally, there is hope for this pandemic to end. Okay. Thank you so much, Dr. Daisy. Thank you for gracing our show. Your insights have been very helpful and reassuring. Welcome back to Lifeline. The youth has been engaged in current events now more than ever. We speak up and involve ourselves in different discussions that can help the community. Together with us is a Famasian medicine student and the UST Medicine Student Council Interim President, Mr. Jason Anthony Supeña, as he will give his youthful take about the vaccines. Good day, Jason. I know you're busy due to online class, so thank you so much for giving time and being one of our guests for today.
Yeah. So good afternoon, Hans, and good afternoon to everyone who is watching this live. So I would also like to thank all the organizers for inviting me and for this opportunity to talk about the vaccines and the pandemic.
All right. Thank you also, Jason. So now, let's start. Jason, as a medicine student and from a different perspective, as a younger person, how important is it to raise awareness towards the vaccination?
Well, first of all, generally, I think a lot of people will agree with me that vaccination in general is a very safe and effective way in preventing a lot of diseases, and not only COVID-19, and ultimately in saving lives, of course, especially here in the Philippines, where a lot of vaccine-preventable diseases exist, such as polio, measles, diphtheria, influenza, to name a few. And I think a lot of people don't realize that through vaccination, we do not only protect ourselves, but also the individuals who are not eligible to acquire certain vaccinations. In the context of COVID, vaccination is considered, as Dr. Tagarda mentioned in the earlier segment, that it is one of the most promising approaches in our efforts to curb the pandemic, and addressing concerns and raising awareness regarding vaccination should be the first step to ensure the success of our vaccination plans and programs.
Right, I see. Now, Jason, do you think we as the youth should rush to be vaccinated, or should we just wait in line?
As Dr. Tagarda mentioned earlier, and I also agree with her that the priority of our government should be the frontliners, should be our healthcare workers first of all, and then those who are vulnerable. I think we should wait in line, and instead of rushing to be vaccinated, since we have limited resources. Well, if our resources allow, then by all means we should all get vaccinated, but we shouldn't necessarily rush. However, I think we should further educate ourselves and then be more responsible as the youth in handling things in the pandemic today.
Yes, I agree with you. Well, Jason, UST has already made arrangement to the LGU to conduct face-to-face classes for the medicine-related courses, right?
Yes, yes.
Yes, okay. So as a medicine student yourself, can you share the importance of taking the extra precautions?
Well, I believe majority of us did not really expect that this pandemic would go on this long.
Right.
Personally, I have been waiting for a long time to get back to face-to-face classes. It's just that you see, the gap in learning between virtual and face-to-face classes are that great. However, I think we are still not 100% safe, I would say, with the current situation. So I think it's really important that we should take extra precaution as we go back to face. Like we should still engage in social distancing, wearing the proper personal protective equipment as we go back, and of course, to not how do I put this? Not go outside if it's unnecessary. We can only go outside if it's really essential. That is also to avoid and to minimize community transmission of COVID-19.
Right, right. I see. That's why each and everyone actually should follow the precautions and the protocols provided by our government. Okay.
Yes, that's
So, Jason, in your own point of view, will you consider getting vaccinated first before engaging in face-to-face classes?
Well, if the opportunity permits, then of course I would. I'm currently a third year medical student, so I will not be going back anytime soon. But I'm gonna be a clerk next year, so hopefully by that time I would be able to go back. And if the opportunity permits, and if there are resources available, then by all means I would love to be vaccinated. I'm currently in Iloilo, and our LGU has already issued a vaccine deployment and immunization plan a few weeks ago, I think, as far as I can remember. So, should the vaccines be ready and available before I come back for face-to-face classes, I would gladly take the opportunity to do so.
All right. But what if the vaccine has not yet come? Would you still be willing, or would you still be willing and you just have to consider the precautions? What
Yeah,
do you think?
personally, I would be willing to go back to face-to-face classes, even if I don't get the vaccine beforehand. I would, yeah, as you mentioned, I would just carefully take extra precautionary measures as I go back.
Right, right. Okay, thank you for that. So lastly, Jason, to the extent of your knowledge, is there any reason for the youth to hesitate getting the vaccine?
Personally, I don't think so. Well, you see, vaccine hesitancy stems from a lot of factors, but more importantly, in misinformation and misconceptions. That's why a lot of people are hesitant in getting the vaccines. So not only the youth, but a lot of people are concerned about the safety and are skeptic regarding the relatively rapid, development of the vaccines. Because as we all know, or a lot of vaccines are developed years. So, however, this COVID vaccine has just been developed because of the pandemic, of course,
Right,
and now
right.
it's being now. So, however, a lot. Also, I think factors include also that a lot of information, whether true or not, are easily accessible in social media, in the internet. So I think there are a lot of conspiracy theories, surrounding vaccines, even way before this pandemic. So I think that really contributes to vaccine hesitancy, not only among the youth. So I think it is vital to address this. I think it's vital not only to educate oneself, but also others, and for individuals who are in the field of healthcare, be open to discussion regarding the vaccinations.
Right.
Only then can we improve vaccine acceptance and achieve the coverage, as Dr. Tagarda mentioned, the 70% coverage that can result in a significant impact to the current situation and to eventually end this pandemic, hopefully.
Yes, I agree with you. So, Jason, earlier you told about education and how vital it is in terms of, making sure that people would get the vaccine. So, I know that different councils in our university, different student councils in our university cannot educate the entire Filipino people, right? But at least the Thomasian community. Now, on the end of the the FMS Student Council, do you guys plan on, doing something in terms of informing the people, specifically the Thomasian community?
Yes, of course. We have plans in the next few months regarding, addressing vaccine concerns, and of course, promoting vaccination, not only COVID vaccination, but also the other diseases. Because I think in this during this pandemic, a lot of people really have, I think, hesitated to update their vaccination records and or pay attention at least to the other vaccine preventable diseases because of the pandemic. So I think so as a council, we have a lot of plans, not only for the Thomasian community but also to the Filipino people, that as much as we can reach.
Right. That's good to know that our different student councils also have plans. Now, Jason, I just like to know what message, or do you have any messages for the people or for the Thomasians who are hesitant in taking the vaccine?
I believe that there is, to all the Thomasians and to all the people who are watching this live, I believe that there is a lot of reasons for you to take the vaccine. I think this is the most promising chance as of the moment to curb this pandemic, and we should take that chance. So more than ever, I think, rather than be anxious or be worried about the current pandemic, I think we should be more vigilant and be more open to all the developments, and we should continuously educate ourselves regarding the current situation, so as that we could address our concerns, debunk all the myths, and of course widen our knowledge and to be able to act responsibly in the future.
Right. And just to add to what Jason said, to all the people who are watching this live stream or this video, I think it's important, Jason, that we should also try to combat misinformation, right? A lot of false information are being spread online. So what are your thoughts on that?
Yeah, I think we should always make sure or verify our sources. Of course, there are a lot of sources that in one look palang alam mo na na it's not legit or it's not real. And of course, if given the chance, then by all means look at the for example, websites like WHO, CDC, DOH. I think that would suffice in terms of getting knowledge in this pandemic.
Yes.
So if we see posts on Facebook or conspiracy theories, then we should always fact check, double check everything, so that we would not mislead ourselves and also others.
Right. Thank you for sharing that, Jason. So to all people who are watching this and to all people who are hesitant in taking the vaccine, make sure to double check the information that you are having or you are receiving. Okay? Thank you so much, Jason, for having this very fruitful discussion with me. It gave us a fresh perspective and it opened up different angles. And we wish you the best, future doctor. Please stay safe.
Thank you, Han. Stay safe.
Thank you also. Bye-bye. Okay. Now, in the country's fight to end COVID-19, the vaccine gave our nation a chance to thrive once more. With proper governance and a well-studied system, our country could bounce back from the losses. Thank you for tuning in to today's episode of Lifeline. It is very important for us to be informed and most especially listen to the experts. Reminding everyone to still practice proper hygiene and take precautionary measures to remain healthy. If we can take care of ourselves, we should also take care of others. Bagong umaga at bagong pag-asa. Once again, this is Hansko, and this has been Lifeline. We improve our lives by feeding our minds. Take care of your health, and see you next time, Tigers.